Has been dealing with many concerns in the wake of the COVID-19 outbreak: testing, contact tracing, unemployment, and when it will be safe to reopen the state for business again. State Senator Eric Lesser addressed all of those topics and more when he spoke with Connecting Point's Carolee McGrath recently.
It's important, I think, for people to appreciate, Carolee, that Massachusetts is right now one of the hardest hit states. We are third in total cases nationwide, only behind New York and New Jersey. We are also very high on really all the metrics that you don't want to be high on right now in terms of hospitalization rates, cases per capita, positive cases per capita. Part of the challenge we have is we are, of course, very close to New York City, and there's quite a lot of commercial and personal contact between the two regions. We also had our own major outbreak here in Massachusetts, in the Boston area, the Biogen conference, which I believe we talked about, about a month ago when we were last together, was a major super spreader event, so to speak. So Massachusetts is absolutely in the center of the storm here. We are in the surge. People need to be cautious, but people also need to be focused. If you are staying home, if you're practicing good hygiene, if you're trying to stay at least 6 feet apart from people, if you're wearing a mask in public, you're doing your part to flatten the curve.
So when you talk about those deaths again, though, about half of them are from people who lived in long-term care facilities or nursing homes. How do you support them and shore them up, especially as we move forward in handling this crisis?
Yeah, our nursing facilities, our long-term care facilities are really at the center of this crisis. The Soldiers' Home really shocks the conscience what happened there. Horrific situation. We've been working very closely with the Baker administration and the Department of Public Health to surge resources to our assisted living facilities. There was a major outbreak at JGS Life Care in Long Meadow, for example. We have dozens of nursing homes and senior living facilities across Western Mass that we're closely tracking and keeping an eye on. A new National Guard unit has been mobilized over the last several weeks. Dozens of individual National Guard testing units are now being deployed to nursing homes to do 100% testing across the board of all staff, of all residents, to help supplement the workforces in those facilities to make sure that they have the resources they need, that they're properly segregating patients and residents. It's a major challenge. This is one of the hardest populations, both to control the spread, because you have a lot of people often sharing rooms, living in close quarters, but also this is a population that's very vulnerable to the illness. They're at an advanced age, often have many other underlying health conditions. Nursing homes, congregate living facilities are at the absolute top of the list in terms of emergency capacity that we need to surge to.
Talk a little bit about just the idea of eventually opening up again. You had mentioned that Massachusetts is the third hardest hit state. Dr. Deborah Birx, who is part of the National Command Team, has mentioned Massachusetts in particular. But at the same time, the federal government has announced a 3-phase plan. How realistic do you think that is, and how soon do you think Massachusetts would be able to open up, and would it be in consultation with Connecticut and New York, as has been discussed?
So a few things on this, Carolee, and thanks for asking. This is a very important topic. So first, I understand and am very sensitive to the really extreme economic pain that this is causing our families, our communities, our businesses, certainly worldwide, certainly nationwide, statewide, but also in our own community here in Western Mass. I chair our Committee on Economic Development. We've talked about this many times on the show. I'm working with state leaders on the economic response plan. We understand full well the pain that this is causing and the strain this is causing. Hi, Nora. You want to say hi? This is causing our local businesses. I'll be here. You want to just play right there? We're all making adjustments.
Honestly, yeah, that's not a problem. We are making adjustments. This is real life and a beautiful little girl as well. But in the midst of all this is how we're, as you're talking about that pain of people, being away from work or some people who are unemployed. That was a great example of just being home.
And they're being good sports because their routine has been disrupted. But the point here really, though, is, Carolee, is that they have to go in concert with each other. the health response and the economic response are linked. They can't be viewed as in a vacuum. One is going to be dependent on the other. And so, yes, we have to work regionally. Quite frankly, if Massachusetts opens up, but Connecticut doesn't, that is in nobody's interest. If Rhode Island opens up before Massachusetts, that doesn't help either. There's quite a lot of cross-border contact that needs to be coordinated. So it needs to be done regionally. But the main thing I want to get across to people is that the health response is going to inform the economic response. And they have to be done that way because, quite frankly, if people are afraid of getting sick, if they go outside, if they're afraid of getting infected, if they are in their office, then we're not going to see the kind of economic bounce back that we need. And so we need widespread testing, and our state is really ramping up testing capacity. I want to give a really acknowledgement to Bay State, which has done incredible work ramping up their local testing capacity, as has Mercy Hospital. And we need to do very robust what's called contact tracing. You have support teams that come in to make contact with all the people that they came in contact with over the previous 2 weeks, so that they can help, get support. Those close contacts can also get support quarantining. That allows you to control the spread, so that the rest of the world, the rest of society, can get back to work.
I think as people watch the news each night, they're wondering when, though, of course, and I'm sure you are and everybody is as well, like when those numbers are going to be, I guess, good enough where people can start phasing back in. But when you look at unemployment, more than 500,000 claims in Massachusetts, how do you help people, who are, just out of work and really want to get back?
Yeah, I mean, my heart really is aching right now for the pain that's happening in our community. And I think really no one has been immune from the impact of this. This is a generation-defining event. This is on par with the World War II, with other defining events for our culture, for our community, for our generation. And I do want people who are watching to know that there are a lot of resources. My website, senatorlester.com/COVID-19. We're trying to compile all the various resources from state, federal, and local government and nonprofits in one place. Unemployment, we've made tremendous changes to the unemployment system, really generation-defining changes. For one, we've waived the 1 week waiting requirement. We've waived the job search requirement. The federal government has given an extra $600 a week across the board to all unemployment insurance claimants. So if you're a traditional W-2 claimant, you can go online hopefully easily to get your unemployment, and we're working every day with constituents to help expedite that. The other element that just came online this week is the pandemic unemployment insurance. This is very important, Carolee, because you and I have talked about this on the show, the limitations of our current unemployment system. If you are an independent contractor, if you are a self-employed business, if you are, let's say, an artist that performs at concert halls or at bars or restaurants on the weekend, you of course have been out of work because of this pandemic. If you're an Uber driver, if you're an Airbnb host, those types of jobs had not been included in the traditional UI system. The federal government made a very important change, bringing all those workers into the unemployment insurance system. That application process went live this week. The payments are retroactive to time of unemployment. So people should go on mass.gov if you fall into one of these categories and you need help. And you can apply right now online for that pandemic unemployment assistance, and you will get help. It's $600 a week minimum on top of the demonstrated loss you can show, whether through a 1099 form, a bank statement, or other documentation. So there's been a lot of expansion. There needs to be a lot more. We heard from a lot of people. The Paycheck Protection Plan, ran out of money last week. Terrible situation. A lot of businesses contacting us. We're hopeful the federal government's going to get that program expanded again. So this is going to be a long process. But the hope is that we can surge resources to people so that they can at least keep the lights on, keep the bills paid until the economy can reopen once the virus spread is under control.